back to my channel. So today let's discuss the compartments of the arm. That's the muscles of the compartment of the arm. The arm is the region of the upper limb that is between the shoulder and the elbow. So this is the arm. So it's between the shoulder joint and the elbow. Okay? Now the arm has two muscular compartments. That's the compartment of the arm. We have the anterior aspect, that's in front, and the posterior aspect, that is at the back. So before going into the posterior aspect, let's talk about the muscles of the anterior aspects of the arm. So muscles of the compartments of the anterior aspects of the arm. So the anterior aspects, muscles of the anterior aspects of the arm, we have three muscles. We have the coracoid brachialis, the biceps brachii, and finally the brachialis muscle. So the first one is the coracoid brachialis. Now when you're talking about the muscles or muscles generally in the body, there are outlines that you should have at the back of your mind when you are discussing muscles. The first is the origin, second is the insertion. First is the origin, second is the insertion, third is the action of that muscle, the innervation of the muscle, the arterial supply of the muscle. So after telling us how the muscle originated, we tell us the insertion of the muscle, the innervation, the action, and the arterial or the blood supply. So let's go. The first one is the coracoid brachialis. It originates from the medial aspect of the tip of the coracoid process of the scapula. Remember that when I talked about the processes of the scapula, I said that the scapula has three processes. It has the coracoid process, it has the acromion process, which is a continuation of the spinous process, and finally it has the spinous process. So this coracoid brachialis originates from the medial aspect of the tip of the coracoid process. Why is it originating from the medial aspect? Simply because the coracoid brachialis is not the only muscle that originates from the coracoid process. Another muscle originates from the coracoid process, which is the short head of biceps brachii. Okay, but when we go into that, you are going to say it. So it originates from the medial aspect of the tip of the coracoid process, the one that resembles a dense finger on the scapula. Then where does it insert? It inserts into the middle 5 cm of the medial border of the humerus. Okay, the middle 5 cm. Remember when I was talking about the borders of the humerus, I mentioned the medial border. Okay, so it does what? It inserts at the medial border of the humerus. Its action is flexing of the arm. Okay, it flexes the arm, while the posterior, most of the posterior compartment will be extending the arm. They are powerful extensors of the elbow. Now let's go over to the nerve supply. It's supplied by the musculocutaneous nerve. Remember that the musculocutaneous nerve is one of the nerves that originates from the lateral cord of the brachial plexus. Please, if you've not watched my video on the brachial plexus, please do so. I'm going to put the link of the video in the description box, and also I'm going to attach it to the end of this video. You are going to understand it better if you have a knowledge and insight about the brachial plexus, the muscles of the scapula, that's the bone of the scapula, and the humerus. Okay, now the next one we are going into is the biceps brachii. The biceps brachii has two heads. Okay, it has two heads of origin. It has the short head and the long head, and these two heads have their different origins. They do not originate from the same place. Now the short head of biceps brachii originates from where? From the lateral aspect of the tip of the coracoid process. Okay, remember that I said that this one originates from the medial aspect. So the short head of biceps will be originating from the lateral aspect, still from that same coracoid process, the tip of the coracoid process. Then the long head of biceps brachii is going to be originating from where? The supraglenoid tubercle. That is where the long head of biceps brachii will originate from, while the short head is going to be originating from the infraglenoid tubercle. But while the long head of triceps brachii will be originating from this infraglenoid tubercle. But the long head of triceps brachii is at the posterior compartment of the arm. So when we go into there, you appreciate it the more. Then the next one is the insertion. It is inserted inserted at the posterior rough part of the radial tuberosity of the radius. I don't have the bone of the radius. I will have showed you the radial tuberosity, but I'm going to drop the picture at the end of this video for you to appreciate it the more. Then it is innervated by the musculocutaneous nerve. The root value is C5 and C6. The action of this bicep brachii is flexor. It is a powerful flexor or a flexor of the elbow. It is also a strong supinator muscle. Okay, when you're talking about supine position and pronate, if I want to do supine and pronate, supine, pronate, supine, pronate. Okay. Now the short head flexes the arm, so it's a flexor of the arm, while the long head prevents upward displacement of the head of the humerus. So this is the bone of the scapula, and this is the humerus. So it's going to be flexing the arm. Okay, can you see that? Perfect. So remember that this head of the humerus we articulate with the glenoid cavity of the scapula to form a shoulder or the glenohumeral joint. But that's not what we are going into right now. So the next one is the brachialis muscle. The brachialis muscle is the last muscle on the anterior aspect of the compartment of the arm. Now the origin is the lower half of the front of the humerus. Where is it going to be taking its origin from? It's going to be taking its origin from two surfaces on the humerus and one border, which is the anteromedial surface, anterolateral surface, and the anterior border. So that is where this muscle is going to insert. The brachialis is going to originate the brachialis muscle. Now let's go over to the insertion. Is inserted at the coronary process and the ulnar tuberosity. That's the rough anterior surface of the coronary process of the ulna. Remember that the coronary fossa is seen on the anterior aspect of the trochlea. Please, if you've not watched my video on the humerus, please do so. Now, this coronary fossa will provide an attachment for the coronary process of the ulna. Do you understand? So this is what some of the articular surfaces of the lower end of the humerus. Remember I said that the lower end of the humerus has articular and non-articular surfaces. Please watch my video on the humerus to understand that better. So let's talk about the action of this muscle. The first is flexes the forearm at the elbow joint, okay, and then is innervated by the musculocutaneous nerve. Remember, I still said that musculocutaneous nerve is a nerve coming from the lateral cord of the brachial plexus, and you know that what forms the lateral cord is the anterior division of the upper trunk and the anterior division of the middle cord gives rise to the lateral cord, and it gives branches. One of the branches is the musculocutaneous nerve. Musculocutaneous, but that's not the only nerve that's coming from the lateral cord of the brachial plexus. Please watch my video on that to understand that better. So that is all for the muscles on the anterior compartment of the arm. Okay, I forgot to mention that the brachialis muscle is being innervated by the radial nerve. The musculocutaneous nerve presents a motor function, while the radial nerve presents a proprioceptive function. So that's all for the muscles of the anterior compartment of the arm. So stay tuned. Let's go into the muscles of the posterior compartment of the arm. Two muscles of the posterior compartment of the arm. The first is the tricep brachii and the second is the anconis. Okay, we are going to talk about the tricep brachii first before going into the anconis muscle. This tricep brachii has three heads of origin. It has the long head, the lateral head, and the medial head. Okay, and all of them have different origin. So the first one is the long head of tricep brachii. The long head of tricep brachii originates from the infraglenoid tubercle of the scapula. If you watch my video on the scapula, you see when I talked about the origin of the triceps brachii muscle. While the long head of biceps brachii originates from the infraglenoid tubercle of the scapula. Remember that this is the lateral angle or the glenoid angle of this particular bone. Please, if you've not watched my video on the scapula, please do so for a better understanding. Now the next one is the lateral head. The lateral head originates from the oblique ridge on the upper part of the posterior surface of the humerus. humerus, okay? Remember when I was talking about the humerus, I said humerus has three surfaces. The anteromedial, which is between the anterior surface and the medial surface. Anterolateral, which is between the anterior border and the medial border. And then the posterior surface. So this particular head of tricep brachii originates from the upper part of the posterior surface of the humerus. That's the oblique ridge. While the medial head originates from the posterior surface as well, just below the radial groove at the posterior surface, just below the radial groove. Now let's go over to the insertion. The long and the lateral heads converge to form a flattened tendon. And where is it inserted? It's inserted into the posterior part of the olecranon process. Now I want you to know that all the heads of the tricep brachii actually are inserted into the olecranon process, but the difference is going to be this one is inserted into the superficial tendon of the olecranon process. Remember that this olecranon fossa is a depression found on the posterior aspects of the trochlea, okay, and it allows for the olecranon process of the ulna, the articulation of the olecranon process of the ulna. So while the long and the lateral heads are inserted into the posterior part of the superior surface of the olecranon process, the medial head is partly inserted into the superficial tendon of the olecranon process as well. Now these few fibers are inserted into the part of the capsule. This prevents slipping of the capsule during extension of the arm and not flexion of the arm. So these fibers are all together called the articularis cubiti or the subanconeus. So having described the origin and the insertion of the tricep brachii muscle, let's talk about the nerve supply. So the nerve supply of this muscle, the tricep brachii, is supplied by what we call the radial nerve. Okay, if you watch my video on the brachial plexus, you'll see that the radial nerve originates from the posterior cord of the brachial plexus, and it has its root value from C5 to T1 of the brachial plexus. Now, these muscles, that's these heads of the muscles, have the different branches coming from the radial nerve. Okay, this long head is coming from the long head of the long head branch of the radial nerve. This lateral head is coming from the lateral head branch of the radial nerve, and this medial head is coming from the medial head branch of the radial nerve. Okay, this branch is coming from the axilla. From this axilla here, it now descends into the arm to supply the radial head. Okay, just near the radial groove. Okay, now it also does the same for the medial head. So the supply or the innervation of this head is the long head branch of radial nerve coming from the axilla, the lateral head branch of radial nerve that descends from the axilla down into the arm, typically near the radial groove, and then the medial head that also continues towards the radial groove. So that's for the innervation of the tricep brachii muscle. Now let's talk about the action of this muscle, the triceps brachii. The first thing you have to know is that the triceps brachii is a powerful extension or extensor of the elbow. It's a powerful extensor of the elbow. And also this triceps, the long head specifically, the long head of those triceps brachii supports the head of the humerus in abduction of the arm, in abduction, taking away of the arm. So that's what this long head of tricep muscle does. So it supports the head of the humerus during abduction of the arm, ABD, abduction of the arm, that's taken away. Okay, so that's all for the triceps brachii. So let's go into the next muscle, which is the anconeus muscle. So talking about the second muscle on the posterior compartment of the arm, we are having the anconeus muscle. This muscle is often considered part of the tricep complex. That's why it's included here. But most authors actually include this anconeus muscle as one of the muscles of the compartments of the forearm. Now the first one is the origin. The origin of this muscle is from the lateral epicondyle of the humerus. Remember when I talked about the lower end of the humerus, I talked about the articular and the non-articular surfaces. And the non-articular surface said includes the what? The epicondyle and the supracondylar ridge. Now this particular muscle, that's the anconis muscle, is originating from the lateral epicondyle. This is the lateral epicondyle, while this is the medial epicondyle. So it's originating from the lateral epicondyle of the humerus. And where does this muscle insert? It inserts into the lateral aspect of the olecranal process. Lateral aspect of the olecranal process and the superior part of the posterior ulna. Okay? Ulna is one of the bones of the forearm. So there are two bones in the forearm, the ulna and the radius. Okay, ulna is the bone that is lying medially, while radius is lying laterally. So let's talk about the action of this muscle. So this muscle is an extensor of the elbow, same thing as the triceps brachii muscle. So you can generally say that the muscles of the posterior compartment of the arm are powerful extensors of the elbow. Do you understand that? Good. Now the next one is the innervation. It is innervated by the radial nerve, and the root value is from C7, C8, and C1. While the tricep brachii is C6, C7, and C8. Now it is supplied, that's the arterial supply, by the deep brachial artery. That is for the tricep brachii muscle. While the arterial, or the blood supply of the anconis muscle, is a recurrent interosseous artery. Recurrent interosseous artery. So that is all for the muscles of the compartment of the arm. If you have watched my video till this end, thank you for staying tuned and staying to the end of this video. My name is Joy Onyi. I am a basic medical lecturer and I teach anatomy. I am an online tutor and I own an educational channel on YouTube. I also have a Facebook page where I post most of my notes from the videos on my YouTube. Please do well to subscribe to my channel. If you find this video interesting or my lectures interesting, subscribe to my channel, like my video, please give it a thumbs up and share my video so that more people can get to see my videos. Thank you very much. See you all in my next class. Bye.